Reactive Attachment Disorder presentation by Amanda Waugh and Linda Holmstrom Shiebler.
Reactive attachment disorder, also known as RAD, is a disorder of attachment that has an onset before 5 years of age and affects children who have received pathogenic care. For a child to receive a diagnosis of RAD, there needs to be evidence of some serious social neglect. Almost all literature agrees that there is a severe lack of research and studies on the topic of reactive attachment disorder, despite numerous cases focusing on children with RAD symptoms in maltreated environments. Most studies focus on children who are institutionalized or who have been adopted out of an institution, as well as children from the foster care system who have entered due to maltreatment. There are two specific types of reactive attachment disorder defined in the DSM-4, disinhibited type and inhibited type, although they are not separated in the new DSM-5. Children who have disinhibited type of RAD are over-sociable, fail to show selective attachments, and demonstrate clinging and/or discriminate friendliness even among strangers. Children with inhibited type show a lack of social approach. These children exhibit emotionally withdrawn and hypervigilant responses and seem frightened of others. This child would also be one who refuses comfort on all occasions. Due to the maltreatment associated with reactive attachment disorder, it is unethical to allow a child to remain in the neglectful environment to be studied. Because of this restriction, it is safe to assume that any child in a neglectful environment is at risk for developing reactive attachment disorder. Most research in the past has focused on orphanages in Romania, but this does not mean that Romanians are at a greater risk for RAD. The National Incidence Studies of Child Abuse and Neglect, also known as the NIS, estimated that 2.3% of the U.S. child population had met the harm standard for maltreatment in 1993. It was also estimated that 0.57% of the U.S. child population were physically abused. This number is believed to have increased since 1993.
While there may be agreement that attachment is a foundational stage of development, clear consensus on how to treat children when attachment is not achieved remains more challenging. This presentation focuses on 3 examples: a case study, an experiential model, and a psychotherapy model. In the case study of a 4-year-old boy adopted out of a neglectful and abusive environment, both the therapist and adoptive parent successfully worked together to ensure that a baseline of secure attachment was the precursor for any behavioral changes by the child. Trauma impacted children have been identified as having higher cortisol levels. Experiential treatments such as equine therapy have been shown to reduce these cortisol levels through pre- and post data collected. And thirdly, models such as dyadic developmental psychotherapy have been identified as effective evidence-based treatment based on growing data collection. Overall, the key points of effective treatment include ensuring a baseline of secure attachments being precursor for any behavioral changes, building a strong positive therapist-client alliance and bond, responsiveness to experiential opportunities and data collection, and evidence-based psychotherapy. In conclusion, there remain many challenges in the identification and treatment process for reactive attachment disorder, starting with diagnostic criteria. Lack of scientific study models due to moral standards of practice, while appropriate, are barriers nonetheless. Studies beyond institutional settings specifically are needed to better identify effective treatment. Adoptive parents may provide research-based evidence opportunities in light of these barriers. Each case for children diagnosed with RAD contains multiple contextual dynamics, and currently there is no data available for impact on minority populations. While treatments such as the dyadic developmental psychotherapy models have been able to produce some evidence-based outcomes, and experiential treatments such as equine assisted therapy have positive results, there continues to be a need for standardized treatment protocols to be developed. Most importantly, more research is needed on how to best address prevention and creating models of intervention around attachment reparation for children who have been impacted at the deeper levels of trauma.